Welcome back to Born for This Stories, where we speak the truths no one told us, so you don't have to carry this alone. Welcome back to Born for This Stories, where we speak the truth no one told us, so you don't have to carry this alone. Today, we are joined with Christy, a mom of three, a physician, and the founder of ThriveWell Functional Pediatrics right here in Florida. But before she was helping other families navigate chronic health concerns, she was a medical mama in the trenches herself. Her son was born with congenital GI condition called Esophageal Atresia with tracheoesophageal fistula, which means his life started with surgery and a month in the NICU. And even after surviving that beginning, the journey did not end there. As he grew, Christy began noticing things that didn't feel right. Nighttime vomiting, difficulty potty training, symptoms that kept coming back. But again and again, she was told everything was fine. Today, we are talking about the moment a mother's intuition refuses to quiet, what happens when the medical system dismisses your concerns, and how this experience led Christy to build a completely different way of caring for children. If you ever sat in a doctor's office feeling like something was being missed, this conversation will feel very familiar. Christy, welcome to Born for This Stories.
Alrighty, well, thank you again, Christy, for joining us. If you could, just give us a little rundown about your family, your business, and what you have going on in life.
Well, thank you guys so much for having me on. So I'm Christy. I own ThriveWell Functional Pediatrics. I opened about a year and a half ago. And I am the mom of three kids. I have a 9-year-old daughter and a 6-year-old son and a 4-year-old son. So we're pretty busy over here. We're kind of still in those little years.
Yeah, for sure. Oh my gosh. I cannot wait to get more into your story and see how you manage 3 kiddos and a practice. You're like superwoman here.
It's a balance. It's a balance for sure.
Yeah, absolutely. For sure. Well, cool. I know that obviously we definitely want to talk about your work because I know from my understanding, your story that you're going to share with us has gotten you to the point of what you practice and have that love for. But I want to start with like your journey first and like to the space of like medical parenting.
Yeah, so my second child, my first son, is 6, but when he was born with something called esophageal atresia. We did not know prior to his delivery. My entire pregnancy was a very different pregnancy than my first one, and I told the OB many times, I feel like something's off. I don't feel good. It doesn't feel right. But, they don't, there's a lot of people, and I kind of understand both sides. I've worked in conventional medicine my whole career. So I do understand, like, you got to see the patients, you got to get them through, but we don't
Sure.
tend to listen to moms when they're telling you that. And, when a kiddo has esophageal atresia, you tend to accumulate a lot of amniotic fluid. So I was really much bigger than I was in my first pregnancy, which made it pretty uncomfortable. And they just kept telling me, he just has a bigger pool of water to splash around in. Everything's fine. Everything's fine. And so because I had so much amniotic fluid, they had to induce me at 40 weeks because the way that most people know this, but the way that your cervix dilates is by a baby's head pressing on it. And whenever they're floating around in a big pool of water, that head doesn't get pressure on your cervix to dilate it. So they induced me when I was 40 weeks. And then after I delivered him, he kept turning blue, like his little lips would turn blue.
Oh, man.
And my midwife just kept saying, it's okay. He got a really good squeeze, like just, a bulb suction his mouth out. So we were doing that, but I had a baby before and he wasn't, rooting like my other baby had and wasn't really acting. He was a little bit listless. So she just brought down the respiratory therapist to do a deep suction on him, maybe thinking that he had kind of breathed in some of that amniotic fluid. And when they came down to do that deep suction, when they put the tube in, it just came right back up. So for those of you who don't know what esophageal atresia is, a baby is born without their esophagus attached. So there's a space between the top portion of their esophagus and the bottom portion. And then my son's bottom portion of his esophagus was attached to his lungs. So they call that a TEF. So they took him down to get an x-ray. Ultimately, we ended up in the NICU right after he was born. He went to surgery. I think he was about 17 hours old. So he had an 8-hour surgery for that first day of life, which repaired the esophageal atresia. We felt extremely fortunate because babies can be born with two types of esophageal atresia, short gap and long gap, which
Mm-hmm.
indicates how far the esophagus is removed from itself.
Sure.
His was a short gap, thankfully, so they were able to repair it right away. And then we ended up spending another 3 weeks in the NICU. He had some leaking around his anastomosis site. He had a collapsed lung. We had some
Oh.
feeding difficulties. So we
Yeah.
had a little bit of a complicated course. He was on many rounds of antibiotics. And so once we got out, I was still able to nurse him, which I was really, really thankful for.
Yeah.
And he was on Nexium for the first year of his life to kind of prevent reflux and things like that.
Yeah.
But right out of the gate, we noticed he had eczema. I had to cut many things out of my diet to kind of keep that under control. He was vomiting a bunch. So even from an early age, we were going back pretty often, seeing those specialists, trying to figure
Mhm.
out like what would work best for him. And then around the age of 2, he started doing some vomiting in his bed, where he would wake up with just, kind of vomit all over him 4 or 5 days a week.
Oh my
We were having a
gosh.
really difficult time potty training him. So again, we started, visiting his specialists again, going back again, and they just kept telling us, like everything, this is normal, and he's going to grow out of it, and don't worry about it. But as a mom, when things start to happen to your kid and you see either how much distress they're in or how difficult it is for them, you kind of know that it's not okay.
Yeah, for sure.
So we did some diet modifications, started him like on a probiotic, which helped a little bit. And then I had a friend who had kind of gone through some similar things. So she brought up the idea of maybe doing a stool test on him. And
Hmm.
that's really kind of whenever I started to dive into the functional medicine world. And I felt really fortunate because I am a practitioner and
Yeah.
I was able to order these tests and I was
Yep.
able to interpret these tests and get a hold of specialists who could interpret these tests for me. And kind of through that process, I realized that this is really a niche that many families want access to, but many families don't have access to. So once we got him stable, he ended up having a couple of allergies that we found out. So he's allergic to wheat and eggs. We cut that out, and pretty shortly after that, things got increasingly better for him.
Great.
He started to go to school. He had some sleep apnea, so he got a palate expander, which kind of improved things further. So we've been on several journeys with him to kind of get him where he is now, but he is a different child, and I am convinced that he would have been on ADHD medication, kind of on that route, if we had
Yeah.
not intervened.
Yeah.
And not to say that those things for parents are not the right path, but for us, I wanted to make sure that if we got to a spot that he needed long-term medication, that we had done everything else to rule out any other things that could be contributing to his problems. And so now he's a thriving 6-year-old who sleeps all night, who wakes up rested, who doesn't throw up on himself. And so,
No.
is able to
Yeah.
be potty trained and meets all his developmental milestones. And I just felt like it was something that I really wanted to bring to my community and to other families who were looking to, some alternative ways. Because when you're going back to your specialist, the people that you trust to give you the answers, and they're telling you that everything is fine. And as a parent, it really feels like it's not okay,
Hmm.
but they don't have any other alternative ways to treat or, information to give you. It can feel really difficult. It can feel really lonely, and can feel like you're advocating in an area for your kid that there's no solution to.
Yeah, for sure. And the more people that we talk to as well, it's a very similar like theme across the board. And that's hard as a mom, as a dad, that you feel like something's off. You want to do something different, but either it's just not, the education's not there, but now we know, people like you exist. So it would be nice to like marry those worlds together. So if a parent was looking for ways to support their child more holistically or functionally versus just some of the mainstream things like that information was provided. So
Yeah, so I entered a mentorship with Dr. Elisa Song, who's an integrative pediatrician in California. And so I trained with her. And that's really where I tried to marry those two conventional and holistic worlds. So although my practice name is functional pediatrics, I really do try to practice integrative medicine.
yeah.
I was conventionally trained, and so I do have one foot firmly planted there. I do think antibiotics save lives. I do think medication is important,
Yeah.
but at the same time, I do think we overuse it. So I just try to be somewhere in the middle and talk to families, through those concerns and see what we can do to get them to their goal.
Yeah, for sure. I think that's a beautiful blend in the way that you painted that picture because unfortunately, like a lot of scenarios too with medically complex children require both, right? Like,
Right.
or definitely
Absolutely.
more of like the mainstream medical. And we obviously never want to discredit any of that. It's there, it's needed. And I would never want a parent to feel a way that they provided an antibiotic or a pain reliever to their child because they absolutely needed it. Like that's totally okay.
Absolutely.
Oh, yeah,
Absolutely.
for sure. So it is a beautiful thing that you are doing for sure. When you were going through your journey with your son, was there like, go a little bit more into, if you don't mind, like, was there a spot where you really felt like you were talking about, like there just was like a resistance, there wasn't that support there? And, how did you start to find that support?
Yeah. So he was repaired at All Children's, and I have nothing but wonderful things to say about their surgery team. I worked for them for the first year that I was out of school. So when he was born and they were not able to suction him out, I immediately knew what was happening. And thankfully, I had worked with them. I knew their surgeons.
Yeah.
But they weren't able to provide me with kind of the long-term support I needed. And neither was my pediatrician, unfortunately. And so I really did start to look outside of our community for that support. I started to look for people who I felt like were kind of thinking more along the lines of alternative. And I do think the internet is good and bad, but it also connects you to people kind of in the greater community who kind of align with your way of thinking. And so that's when I found Dr. Song. She wrote the book, Happy Kids, Healthy Kids. And it's kind of where I started with her, is her book. And then she has a practitioner mentorship that I entered, where she kind of mentors you one-on-one and, through master classes and through monthly, Q&As about patients, kind of mentors you through the steps of treating someone functionally. And I think that community is really where I found the anchor of, okay, these are the concrete next steps. And I don't have to question whether this is right or wrong. Because every time I went to the pediatrician, their lines were, I've never seen that be helpful. I've never seen cutting out, foods be helpful. I've never seen a probiotic be helpful. I've never seen blood work be helpful. And that just can't be true, right?
I know.
Never,
never, not even like
never seen it be helpful. Right. Like, so it's just, but these are tactics that are used to sometimes make families feel like what they're experiencing isn't legitimate. And I also advocate for families, if you're in a practice that you feel like your concerns are continuously being dismissed, it's probably time to find a new practitioner. And that doesn't mean having to pay out of pocket, but it does mean trying to find a pediatrician or a primary care practitioner that aligns more with your way of thinking. And there are those practitioners out there. Just asking around in your mom community, but don't stay somewhere that you're feeling continually dismissed or that you don't feel like you align with their way of thinking, because there are other practitioners out there.
Yeah, for sure. And we always like to empower parents too, that it's okay to search around and shop around and like you said, find someone that's more aligned with you or that's going to listen more to you. And it doesn't make the provider that's not doing that a bad provider. It's just not a right fit for what you and your family are looking for.
Absolutely.
And that's totally okay, right? Like there's tons of people out there, tons of practitioners out there, but find one that aligns with you, your family, and your goals with how you're trying to manage these scenarios that these kiddos have. Nothing wrong with
Yeah,
that. And like you said, some
100%.
are, and it doesn't necessarily mean that you have to go cash pay either. There are other providers out there and you are allowed to change. You're allowed to.
Yes. And you're allowed to advocate for your child, because you are their only advocate. So
Yeah.
I try to remind parents, like, it's okay to ask questions. And if you have a provider that doesn't want you asking questions, it's a red flag.
Yeah, yeah, for sure. We definitely have found that along the way as well. And it's okay to listen to those red flags, listen to that mom gut and or dad gut and red flag. And there's tons of providers out there. Go find somebody else for sure. I'm glad that you provided that. That was really helpful. So I would love to chat a little bit more in that regard too about just were you working with kiddos? Like, were you working with pediatric patients prior to what you're doing now?
So the first part of my career was spent in the emergency room, and I did work in pediatric emergency and adult.
Okay.
And well, so to back up, the very first year I got out of school, I worked with the surgery trauma team at All Children's. Then I moved into the emergency department, and I did that for about 10 years, where I worked with both adult and pediatric patients. And then during COVID, we were furloughed. So I moved into some research. I did research for a couple of years. And after that is when I opened my practice.
Oh,
But
wow.
yeah, I worked with pediatrics all along the way.
Yeah. Yeah. I just find it so interesting to see like people's journey on how they get to these points, like, and it seems like you were blessed to have like some experience that you need to get you through this situation with your son. And then it's turned into something amazing that helps other families.
Yeah, and I just felt like or it felt like to me at the time when I was getting into functional medicine, there was a lot of adult providers. But
Yeah.
when I was looking for someone to even just chat with about my son and see, like, would this be something that could be helpful for him? I
Yeah.
really couldn't find anyone. There was a provider that I did find in the area, but I felt like it was beyond what my family could afford for just a chat.
Sure.
And I had talked to some families who had been that route, and a lot of them say that they walked away with 15 supplements and not a
Hmm.
whole lot of information. And that was helpful for me because when I started my practice, I didn't want to be that person who was like, well, let's take these 15 supplements and that will help it. And I'm
Yeah.
not saying that we don't do supplements, because we do sometimes, but I also want it to be realistic for a family, because I
Yeah.
know that that wasn't realistic for my family.
Yes. Yeah, for sure. Absolutely. Yeah. I love that you have that type of like philosophy inside your practice. I want to chat a little bit more about that. And also, um, yeah, why don't we just pivot into that? Like, tell us what you like to focus on, how, like, what would be your ideal day inside your practice? Are you virtual? Are you in office? Like, tell us all the things.
Yeah, so my practice is virtual. A lot of times by the time a kiddo comes and sees me, they've seen several specialists.
Hmm.
So I have found that it works really well for families. It's hard. My intake appointments are between 60 and 90 minutes long. So it is
Yeah.
really difficult for a family, for a kiddo to sit that long in your office to be interviewed and talk about their history. So for now, this has been working. And then I see a lot of different kids. I see anywhere from kiddos with eczema. I see behavioral concerns. I see pans and pandas kids, kiddos with belly issues like constipation,
Yeah.
vomiting, GERD, food intolerances. So I kind of see a pretty wide variety of kids. But I try to listen, and I tell families a lot, tell me what your concerns are. Tell me what you think is going on, because I never want to dismiss, even if it's not the top, if I listen to your story and it's not a top differential for me, that doesn't mean that the family is wrong, because
Yeah.
it could be more than what I think it is. And so I really try to validate families. I really try to talk to families and ask them, because they're the ones who spend the most amount of time with their kids,
Mhm.
and they see a way more than the practitioner sees.
Yeah, for sure. So when you have these kiddos coming in, I mean, are you working with like babies? Are you working with toddlers, younger adults, all of the above?
I work with birth.
Hmm.
till about probably 16,
Okay.
14 to 16
Yeah.
are my oldest kiddos. Not that I wouldn't see a kid up to 18, but usually they're seeing more of adult practitioners or have been kind of seeing a more adult practitioner, which is fine. I would say the majority of my patients are probably 10 and under.
Hmm.
So I see a lot of kiddos whose parents recognize kind of early on something might be going on and want to correct it sooner rather than later.
Yeah, for sure. And then how would our listeners know, like, if this would be a good route for them?
I would just say if you feel like you have been hitting a wall with your practitioner, or you feel like they have kind of been sending you around in circles. For instance, if you have a kiddo who has eczema and their alternative is just a steroid cream and
Hmm.
it really hasn't been working, and you feel like you've seen a lot of people, but they're just kind of doing the same things, sometimes a functional medicine provider can give a fresh perspective on some alternatives. I wish that I saw more kiddos for wellness. Like I wish I saw
Yeah.
more kiddos for a gut test at 3 or 4 so we can make sure they're on the right track. But unfortunately, that's kind of not where we are quite yet
Yeah.
with medicine, because I think it can be really helpful for long-term health.
Hmm.
But, I try to give a perspective, a little bit alternative perspective on some things that can be helpful for not only your kiddo being healthy now, but for your kiddo being healthy as they kind of go into adolescence and young adulthood.
Yeah.
A lot of changes happen then. So, yeah, make kind of preparing them for that healthy future.
Yeah, for sure. And I think that's good to highlight too, because I mean, obviously, there's all kinds of different like medical complexities that happen with these kiddos, no matter if they were diagnosed like in utero or after they are born. And we've seen all kinds of different severities. But like for our case, like we're, for the most part on the other side of it. And so onward and upward, for lack of better terms. However, like when we were going through it, like our son was he was under anesthesia 3 times. He was on antibiotics 3 times and, different types of medications. So because we have that holistic mindset, we've already done a lot of these things and looked into this stuff because we want to set him up for success later. So I would love if you feel comfortable educating the audience a little bit about like if your child has been under some medical care, which is necessary, but why are some reasons would we want to check them? Like because possible like change in the gut and different things from the medications that they're on. What do you usually
Yeah,
see?
so we know that the more rounds a child is on of antibiotics without any sort of repair, so that would mean like probiotics, things to help re-inoculate the gut with beneficial bacteria. We know that those kids are at greater risk for things like anxiety, depression as they get older.
Yeah.
But we can help by knowing and helping our kids kind of develop a more resilient gut. So it all starts really prenatally. So if mom's gut is not optimal, and then they have a vaginal birth, and so we're inoculating baby's gut with not optimal bacteria, we kind of are already starting on a road where baby could develop things like eczema early on, skin changes. And so those are really the first kind of things that we see. And then we start to see babies who are spitting up more, who are developing colic and things like that. And
Yeah.
so we can intervene really early to kind of help correct those things.
Hmm.
But sometimes whenever you're going to your pediatrician, the answer is they'll grow out of it.
Yeah.
And so just having parents recognize that maybe there could be something more going on here that they don't just need to grow out of. So babies' guts look very, very different than adults' guts. And that's one thing I would really love for people to know, because we can't just give them whatever, give them, any sort of over-the-counter probiotic. As long as it says baby, you can give it to them. But we can't give them adult probiotics because their gut looks different. And
Hmm.
we know when beneficial bacteria is low, opportunistic bacteria can take over.
Yeah.
And that causes a lot of things, because about 70% of our immune system lies within our gut. So then we start seeing kids who are sick more often. They're sick for longer. They're not able to build resiliency when it comes to being sick. And that leads to autoimmune conditions. It can lead to long-term eczema. It can lead to long-term food allergies, environmental allergies, and, a whole host of things that
Mm-hmm.
can be corrected. It just takes a lot more work the older your kiddo gets.
Yeah.
And then, of course, we do see a lot of gut disruption in autistic kiddos. So that can lead to behavior problems as well. And so I like to impress upon families that I know that gut health isn't the forefront of conventional health, but it really should be, right?
Yeah.
Because if we can correct these things, just because your kid has a diagnosis doesn't mean that they should always be stimming or always be banging their head. Those are not usual behaviors. And so if we have a kiddo who has not had those behaviors and now they do have them, we kind of have to start thinking, why? What else could be going on? And just because your kid has a diagnosis doesn't mean they can't also be sick. And so I just think it's a big misconception that a lot of pediatricians give families like, well, this is just the way they're going to be. This is just, the course of, how they are. And
Yeah.
it doesn't, your family can function and not, the behaviors don't have to kind of impede on your daily life. There is stuff we can do about it.
Yeah. I love that. I'm so glad that you mentioned that because that could help change someone's life significantly.
Yeah. And, I think that whenever you start to go down this hole of gut health and what we can do to help our kids not have these chronic illnesses, it really opens your eyes to how important it really, it is, and the lack of education that is really there for families.
Yeah.
And if I could change anything, that would be one thing that I would change, is some of that education happening prenatally.
Yeah.
Because I don't think many moms realize it.
Yeah, for sure. I've definitely had tons of conversations along the way, and parents are like, "Well, I don't know how they would have like a bad gut, like they're brand new." And so there is just like this whole like area that we don't talk about that like, well, you made the baby. Like the baby is made of what is going on in your body and your partner's body, and that's what they're made of. And it's also
And there's situations where we can't help but a baby be born by C-section, right? Like
yeah,
there's
100%.
millions of lives that are saved, both mom and baby, by babies being born by C-section. But we know that babies who are born via C-section, that their gut microbiome looks like the operating room and not
Yeah.
like mom's gut.
Yeah.
And so that looks like a lot of opportunistic bacteria in their gut. And so just knowing that from the beginning is helpful for moms, because they start to think, oh, okay, well, I do need to start paying attention. If they do develop, eczema or something or skin changes, I can be on top of it.
Yeah, for sure. Absolutely. Yeah. I think that skin is a big indicator and a big,
Yeah.
like, it should be like a big alarm that like the gut is not well.
Well, we've seen that
Like a
as
window to the gut.
Yeah.
yeah, we've seen that with in other stories and multiple different things,
Mhm.
that it's just a side effect that shows itself either first or more prevalent than anything else. So that's interesting
Mhm.
how it's all tied together like that.
I
Yeah.
know. And, in conventional medicine, we never make the connection of the gut to the skin or the gut to the brain, the gut to the lungs. But it's all connected. And
Yeah.
so the idea that our body parts are separate, in conventional medicine, you go see someone for your brain and you go see someone for
Mhm.
your lungs and someone for your heart. But we never talk about how those things are all connected
Yeah.
together, which I think is a misstep
Sure.
in the conventional world.
Yeah. I agree with you there. It's like we're one system. Like, why would it not cross over and, and have
Right.
try to play well together or not play well together? So, yeah,
Yeah.
for sure. And I think that's like one thing that I love so much about just like more focusing more on like functional stuff is like you get to see the unit like as a whole versus like you said, like all these individual boxes that make up our body because everything does cross over. So,
Yeah, when I'm interviewing a family and talking with them, we're talking about diet, we're talking about
Mhm.
sleep, we're talking about
Yeah.
things we're exposed to, we're talking about birth and delivery. So we're really kind of covering all of those things because they all play together. For instance, my son was born vaginally, but he wasn't able to be inoculated with any good bacteria because his esophagus wasn't attached. So that single variable plays a huge role on what the rest of his life will look like.
Yeah.
And then you start to bring in NICU stays and hospitalizations and surgeries under anesthesia, like you mentioned. We
Mhm.
start to, compound those variables over and over. And we can see why at age 2, his gut is a complete mess.
Yeah.
And so I just really wish that that was education that's provided to families earlier rather than later.
For sure. Absolutely. And I love this conversation too, because I don't want anyone to be like gaslit that they shouldn't be concerned about their kid going under anesthesia or being on these things, because it's a necessity, but it is total validation to let you know that it's okay to be concerned about what's on the other side of that, and to find people
Absolutely.
like you and find support where you can do things to help them post-op to make sure that their body is healing and recovering from these very necessary procedures that need to be done.
Absolutely. I mean, my son has to do an endoscopy and bronchoscopy almost every year.
Yeah.
There's nothing we can do about it. His risk of esophageal cancer is quite high. So we have to screen him every single year.
Yeah.
Every year when he goes in, I hate it every time, but it's necessary.
Yeah.
And so we do the prep work and we do the things that are needed to keep him healthy, through that process. But like you said, like there are necessary times. That doesn't mean we can't help prep him through it.
Yeah, for sure. I did want to touch base again, like now that your son is 6, I mean, like you mentioned, he does have to have these necessary procedures like at least once a year, but what is he like these days? And I mean, is he doing all the things that another 6-year-old would be doing that didn't have?
Oh, yeah.
Yeah.
He is a rambunctious 6-year-old who loves being outside. He loves to fish. He's in kindergarten learning how to read. He's doing great. He's doing wonderful.
Beautiful.
Yeah.
Love it.
Love it. Actually, this past year, so we go every year on his birthday to check in with his surgeon. And this past year, we were scheduled for our endoscopy, bronchoscopy. And because he has done so well this year, he did not have to have it.
Oh.
So we were really, really thankful. Yeah, we were really thankful.
Yeah, that's so great.
Yeah.
Oh, I love that so much. And then I would love to just like finish up that if to put some good, like just tied up some good words out there for the people that are listening, if there was anything that you would love to just like remind them or like some key takeaways as they're going through these processes with their medical children, what are some like lasting impressions you could leave with them?
I guess I would love to say that in conventional medicine, we are really good at the what, but we're not always necessarily good at the why. So sometimes taking that little step further of asking the question of, we know that it's eczema, but why? Why do we have it? Kind of taking that extra step for families can really be helpful, whether it's with the practitioner that you have or with the practitioner that you're seeking out. Don't be afraid to ask that additional question, because that can be the question that helps heal your child. And that doesn't always necessarily mean that they're never going to have to be seen again or that they're never going to have to be on a medication, but it may be less of a dose of a medication. For instance, kiddos who have ADHD, there are things that we can do to get them on lower doses so their side effect profile is lower. And so it's just asking that additional questions, empowering families to do that, so that they can feel like they do have some control.
Yeah, great. I love that. That's so good. Perfect. And then how can our listeners find you? And also, you are remote? Do you work with families outside of Florida? Like, give us all the details.
Right now, I'm just working in Florida. Okay. You can book a free discovery call to chat with me, see if we're a good fit, or make an appointment at ThriveWellFunctionalPediatrics.com. You can also find me on Instagram at ThriveWell_functional_peds. And I think that's it. I think those are the 2 places.
Yeah, well, we love it. I can tell you're very passionate about the work that you're doing, and that is just so refreshing and so great to see. And I know you're helping a lot of families, and you'll help so many by being here today. We appreciate it.
Yeah. Well, thank you guys so much for having me. It was really fun.
Yeah, absolutely.
Thank you.
Yeah, we'll chat later. Thank you so much for joining us for another episode of Born for This Stories. If Christy's story resonated with you today, share this episode with another parent who might need to hear it. And if you are a family navigating a diagnosis, a NICU journey, or a path that no one prepared you for, just know this: you are not the only one asking the hard questions. You are not the only one trusting your gut. And you were born for this. If this episode resonated with you, we'd love for you to take one simple step. Share it with a friend, another parent, or a caregiver who might need to know they are not alone in this journey. Make sure you are subscribed so you will never miss an episode. We release new stories every Monday. And if you're looking for more connection, resources, or ways to share your own story, come join us on Instagram at Born for This Stories, or visit our website at bornforthisstories.com. Remember, whatever part of the journey you're in, the waiting room, the recovery, or the in-between, you do not have to carry it alone. We see you, we stand with you, and never forget, you were born for this.